So you can actually hold your bladder for a lot of fluid. Hi everyone, this is Dr. Ashley here at the Pelvic Model, and I am making this video in response to the questions you guys had about my last post, which is about the common myths here in pelvic floor PT. The most popular response was in regards to a small bladder. So a small bladder is defined as peeing more than 8 times a day and the inability to suppress the urge to pee once you get it. Strong urges in urine can lead to incontinence, which is something that we can also treat here in pelvic floor PT. Today, I will just talk about an overactive bladder. Neurologically speaking, there's a lot that happens between the brain and the spinal cord to make urination happen. Physiologically, we have these circuits in the body called the Bradley loops. They activate in order for us to maintain incontinence and allow for urination. So there are 4 loops total. So the first loop is where the frontal lobe tells your body to be consciously aware of the fact that you might need to pee and what are the steps that will get you to the bathroom. The second loop coordinates the bladder with the sphincter, so it helps with relaxation, and when one is on, the other is off. So the third loop is where the body starts to relax all of the sphincters to allow urine to come out from your body. And the fourth loop is the reverse, where it allows the bladder to fill. So where you might have some instances of an overactive bladder is that if you pee the minute you feel your bladder is about halfway full, which is within the Bradley loops, you will train your body to always pee at the halfway mark when realistically your bladder can fill the entire amount. So what a pelvic floor physical therapist can do here is that we can help retrain your brain, retrain your bladder to hold your bladder for the full amount and to suppress the urge to want to pee at the halfway mark. Misconceptions with urinary frequency is to do a bunch of Kegels while you pee to solve this issue, which is actually going to make things worse. So if you voluntarily contract your muscles while your brain and your spinal cord is going through those loops, you can actually cause more issues than not. So some of which are increased frequency, you can cause UTI infections, you can cause the feeling of not fully emptying, and you can also cause difficulty initiating or having a smaller or lighter stream when emptying. So it's super important to see a physical therapist that specializes in pelvic floor PT to help you with those issues. So the bladder can actually hold a lot of fluid, roughly around 500 to 600 milliliters. I like to compare that to the size of a venti Starbucks cup. What we can do in pelvic floor PT is 1, teach you urge suppression techniques, 2, retrain your bladder in order to break the cycle of voiding at that halfway mark or before that, and then 3 is identifying triggers in your life that could be causing the urge. You can improve all the symptoms that I listed before and honestly give you your life back, because it is so frustrating when you can't live your life because you're always looking for a bathroom. Well, I hope that helps with some of the myth debunking in terms of having a small bladder, but if you have any further questions, you can schedule with me or any of the physical therapists here at the Pelvic Model, and we would love to help you with your case, and I will talk to you guys soon.